Most people moving to Southeast Asia think about rent first, then food, then flights. Healthcare is the thing they figure out later, and that is exactly backwards, because healthcare is the expense that can go from $0 to $10,000 in a single afternoon, with no warning, in a country where you don't speak the language. I've spoken to expats wiped out by a motorbike accident in Bali, nomads who paid $4,000 out of pocket for a 2-night hospital stay because their travel insurance had a clause they never read. This video is the one I wish existed before I moved. 5 countries, real 2025 numbers. Let's go. Here's the uncomfortable truth. As a foreigner in SEA, you are almost never going to use the public system. Public hospitals are underfunded, overcrowded, and operate in the local language. They're not built for you. That means private care. And private care in Southeast Asia ranges from extraordinarily affordable to surprisingly expensive, depending on where you are. The framework for every country is the same: routine care costs, emergency costs, and insurance premiums. Thailand is the gold standard for medical tourism in SEA. Bumrungrad, Samativage, Bangkok Hospital, all internationally accredited, genuinely world-class. A GP visit at a mid-range private clinic runs $14 to $28. At a premium hospital like Bumrungrad, $42 to $70. Dental cleaning, $40 to $80. Emergency costs are where Thailand surprises people. A 2 to 3 night hospital admission can run $2,000 to $6,000. Serious surgery or ICU time can reach $20,000 to $50,000. Thailand's private hospitals do not cap their billing. Insurance for a nomad aged 30 to 35, $80 to $150 per month. For retirees aged 60 to 65, $200 to $350. Verdict: exceptional quality, affordable routine care, but emergency costs without insurance can be catastrophic. Insurance here isn't optional, it's the whole product. Malaysia is the most underrated healthcare destination in the region and consistently surprises people who've only researched Thailand. A GP visit at a private clinic runs $8 to $22. Specialist consultations at Gleneagles or Prince Court, $25 to $55. Blood panel, $20 to $60. Across the board, cheaper than Bangkok's premium tier. Emergency admission at a mid-tier KL hospital, $640 to $1,700. Malaysia also has government-linked hospitals open to long-term residents at subsidised rates, a safety net Thailand doesn't replicate for foreigners. Insurance, $60 to $120 per month for under 40s. For retirees 60 to 65, $150 to $250, meaningfully lower than Thailand for comparable coverage. Verdict: the best value healthcare system in SEA for serious long-term residents. Lower premiums, lower routine costs, hospital quality that competes directly with Bangkok's best. Indonesia is where healthcare planning gets genuinely complicated, and where the most popular expat destination has the most dangerous gap between lifestyle and emergency care. In Bali, a clinic GP visit runs $30 to $60. The markup on foreign-facing clinics is real, but the critical issue is emergency care. For anything serious in Bali, the standard protocol is a medical evacuation flight to Singapore or Bangkok. That flight costs $15,000 to $30,000. That is not a hypothetical. It happens regularly. Insurance for Bali, with evacuation cover included, $130 to $200 per month. That's the most expensive in this comparison, and the evacuation coverage is exactly why. Verdict: if you're living in Bali, evacuation cover is not optional. It is the most important line in your policy. Read it before you pay a single premium. Vietnam is quietly the best value healthcare destination in the region and almost always overlooked. A GP visit at a reputable private clinic in Ho Chi Minh City or Hanoi, $15 to $40. Dental work is exceptional value. A full cleaning runs $15 to $35. Procedures costing $2,000 in the US can be done for $300 to $600. For serious emergencies in major cities, FV Hospital and Vinmec are capable. Outside the cities, Da Nang, Hoi An, coastal towns, options narrow and medical evacuation becomes the contingency. Insurance, $50 to $100 per month, the lowest in the region. Verdict: outstanding value in major cities. Strong pick for nomads and younger expats. Retirees should think carefully about proximity to quality emergency care. The Philippines has the most variable healthcare quality of any country here, and it's one where your specific city matters more than the country itself. In Metro Manila, a GP visit runs $9 to $27. At top facilities like St. Luke's or Makati Medical Center, specialist consultations run $27 to $63. Emergency admission in a top Manila hospital, $1,500 to $5,000. Competitive with Malaysia, cheaper than Bangkok's premium tier. And the entire process happens in English, the most transparent billing experience for foreign patients in the region. Outside Manila and Cebu, quality drops sharply and evacuation becomes the plan. Insurance: $70 to $140 per month. Verdict: Manila is a genuinely underrated healthcare hub. Location within the country determines your risk more than the country itself. Here's everything in one table for a nomad aged 30 to 35. Country city, GP, visit insurance/month evacuation. Risk Malaysia, KL, $8 to $55, $60 to $120. Low Vietnam, HCMC, $15 to $40, $50 to $100. Medium Philippines Manila, $9 to $63, $70 to $140. Low in Manila, Thailand, Bangkok, $14 to $70, $80 to $150. Low Indonesia, Bali, $30 to $60, $130 to $200. High Vietnam is the cheapest premium. Malaysia is the best value for quality. Indonesia is the most expensive and the most justified, given what that evacuation cover protects you from. Before you buy any policy, 3 things to check. First, does it cover outpatient care, GP visits, diagnostics, specialist consultations, or only hospitalization? Many budget plans skip this and leave all routine care out of pocket. Second, does it include medical evacuation, and what is the benefit limit? You want at least $250,000 explicitly stated. Third, read the pre-existing condition exclusions carefully. This is where most claims get denied. Get written confirmation of what's covered before you pay anything. Healthcare is the one budget category where being wrong doesn't just cost you money, it costs you options and safety. The good news: this region has genuinely excellent private care at a fraction of Western prices. Malaysia and Thailand lead for serious long-term residents. Vietnam is the sleeper value pick for younger nomads. Indonesia and the Philippines require location-specific thinking, more than country-level thinking. Budget for insurance before you budget for anything else. It's the foundation that makes everything else sustainable. Full expense breakdowns for KL and Bangkok are on the channel, linked here. Subscribe for more real money content. See you in the next one.